Welcome to fascia. So fascia is this connective tissue inside of the body. So you know, if you have a piece of meat and there's a bit of fat on the meat, and if you pull that bit of fat, it's like this really thin lining of, I almost think it's like silk, and you can run your fingers through there. So that's fascia. Now, if you're really, really interested to know more about fascia, there's a brilliant video called The Fuzz Speech on YouTube. And it's this bit of a strange doctor, but he does a really good talk. And there's a cadaver in there, and he will show you what fascia is. So if you are very, very interested, go and have a look at that. It's called The Fuzz Speech on YouTube. So every single muscle, every group of muscle, everything in our body has fascia. And it's on the top of your head right round to your fingers. And there's certain lines of fascia. So they don't run down the body like this. They run opposite. So often, maybe you've experienced this before, you've had maybe you've had a hip problem or an ankle problem, and the therapist has actually started doing work on the shoulder. So it's called the kinetic chain. Everything in your body is linked. So some parts of the body have a much different kind of fascia, and in particular the lower back. So you'll have the fascia that comes from the shoulders, it comes down the back, and there's a huge piece at the bottom. So bearing in mind, your ribs are only connected to the pelvis by the lower spine, which is not much. So there's got to be a lot of support around that lower back to also help you stay up, along with all the muscles there. So this is called thoracolumbar fascia. And it's a much more chunky bit of fascia than you might get in other parts of the body. So some poses, as I mentioned in one of the previous videos, I like to hold longer just to give this particular fascia in that lower back an extra opportunity to release. What happens if we don't stretch off, or we don't release, or we don't move, is that fascia can become very stuck and very sticky. So I'm not sure how old you are, but remember in the old days, even when I was a small child, and I'm not that, I like to think I'm not that old, people would, you'd hurt your shoulder and they go, don't move your shoulder, and then you start to lose range of motion within the shoulder. Whereas nowadays, doctors will say you've got to keep it moving. If you've hurt your lower back, you've got to keep some kind of pain-free movement. Like frozen shoulder, it's excruciating pain. But to try and get some movement into the joint, because if you don't, that fascia, technically it's not what happens, but this is how my brain works, it kind of locks the joints where you start having really, really, really restrictive movement. And then to actually reduce the fascia, the stickiness in there, you can do it, and you have to have myofascial release massage. It's excruciating. It's almost like someone's tearing your skin apart. So prevention is better than treatment. So there might be some, particularly in Pilates, it's like move within pain-free. You want discomfort where I can feel that, but it wants to be pain-free. And it's the same when we're in our yin practice. Find that point where you can feel the muscles, just gently, gently pulling, and then we stop there. Because what happens if we go a little bit further, we move away from the connective tissues and we come into working with muscles. So we want to try and stay just that little bit away from the muscles. Now, all muscles have fascia in, about 20% of muscle is made up of fascia. But we don't want to do those strong dynamic stretches. We want we want to try and stay within this limit of slightly uncomfortable. Because also what that does is it helps the joints to open up, gets a lot more blood flowing into the joints. So it's really good for joint health, joint mobility, because we're working very gently with the joints, and it's incredible how much range of motion you can improve and flexibility you can gain from yin yoga, and without really hurting your body. I'm a big advocate for these kinds of movement that we're not hurting ourselves. Like Pilates as well is fantastic. So that is fascia. So it travels across the body. We've got fascia up the side, over the front. So even in some poses, so let's say this is a caterpillar where the legs are out straight and we're leaning forward. Sometimes I can even feel this pulling sensation in the front of my skull and down the back of my head. And that is the fascia. Really bizarre, but I always think, oh yes, it's working as well. The yin's working. So it's bizarre how you can actually feel some of these sensations in your body when we work with the fascia. So I hope that helps a little bit with your understanding and how it's different to, let's say, hatha yoga, which is the normal yoga, or any other kind of muscular exercise. So I'll see you in the next video where I'll be talking about how we breathe in yin yoga.